How does bone TB affect your body? Have you ever wondered how bone tuberculosis, or bone TB, impacts your body? Bone tuberculosis happens when the tuberculosis infection, which often starts in the lungs, spreads through the bloodstream or lymphatic system to your bones or joints. This specific form of tuberculosis mainly affects the spine and weight-bearing joints, but it can involve any bone in your body. The effects of bone TB develop gradually, making it hard to detect early on. In the beginning, you might experience localized pain and tenderness around the affected area. Swelling and stiffness can occur, which may limit your joint movement and function. As the disease progresses, you could face severe back pain, inflammation, and muscle weakness. When it comes to spinal tuberculosis, also known as Pott's disease, the situation can become more serious. The infection can lead to complications like spinal abscesses and deformities, such as kyphosis, which is a hunchback curvature of the spine. If the spinal cord gets compressed or damaged, it can result in neurological problems. These issues may include paralysis of your lower limbs, known as paraplegia, or even paralysis of all four limbs, called tetraplegia. Children with bone TB may struggle with walking or experience limb shortening due to damage to their bones. You might also notice systemic symptoms that are typical of tuberculosis, like fever, night sweats, weight loss, and fatigue. However, these symptoms do not always accompany bone TB. If left untreated, the disease can cause significant bone destruction and deformities, leading to permanent disability or deformity. Diagnosing bone TB can be quite challenging. The symptoms often overlap with other conditions and usually appear late in the disease's progression. That is why early detection and treatment with the right anti-tuberculosis medications are crucial to prevent irreversible damage. In summary, bone TB affects your body by causing localized pain, swelling, and stiffness in bones and joints. It can lead to severe structural damage and neurological complications, especially when the spine is involved. If not treated promptly, these effects can greatly impair your mobility and quality of life. Always consult a healthcare professional if you suspect you may have bone tuberculosis or experience any concerning symptoms.